This podcast episode is sponsored by Microbalance Health Products. For over 20 years, Microbalance has been formulating and offering non-toxic and environmental cleaning products, homeopathic formulas, and professional-grade supplements to help people recover their homes and their health from mold toxicity. Visit microbalancehealthproducts.com to learn more and shop.
Welcome to the Modern Day Naturopath podcast with Dr. Sue. Real talk for those craving deep healing whilst living in a modern-day society. You'll be equipped with knowledge to make profound mind-body shifts that utilize ancient wisdom and will facilitate your healing once and for all. Inspired by Dr. Sue's chronic illness journey and all the real and raw pearls she has learned along the way. Come as you are. It's never too late to start.
Welcome back, everyone. This is the Modern Day Naturopath podcast. This is Dr. Sue. Today, we're going to continue our conversation with Dr. Sparks, naturopathic doctor, mold expert, on the mold series that we've been chatting about for the last, now this would be our third podcast on mold, which is super exciting. Welcome. Thank you so much for joining us again.
Thank you for having me again.
Course. I was actually looking forward to this today. I was like, I really like being able to chat with you. And we talked about this the other day. We, of course, collaborate with patients, but because we work virtually, a lot of times we don't get to talk about this fun stuff. And because we're nerds and geeks, we like to talk about mold and science and naturopathy. And Dr. Sparks is also an acupuncturist. She has a master's in Chinese medicine. For those of you who have not been introduced to her yet, she works at Naturally Sue Wellness. You can make an appointment with her in my practice, and you can also follow her for great tips on mold at her Instagram. You can press pause and look her up at Dr. Sparks, SPARKSND. And today we're going to be talking about mold detox and treatment. And if you're new to this series, we do have a foundational mold podcast that we did, and it's called Mold Foundations. That is the first part. We go through very commonly asked questions, foundational things that you should know, symptoms. And then we have the second podcast that was called Mold Colonization. And we talked about how that can show up in the gut, the respiratory tract, even the bladder, as well as the sinuses. So that's a really juicy episode as well. And I wanted to actually talk a little bit about detox first, because as you know, it's a huge buzzword. Everyone wants a detox. And I want to talk about what you said the other day when we were chatting about this podcast. And you say, people often ask me, what can I take? What can I take? Well, what supplement? And you said it's more, what can I do? So I really loved that you said that. And so I want to talk more about that and what type of things people can actually do for themselves. And then also talk about this topic of detox and maybe, as layman's terms as possible for people so that they know, what are pathways of elimination? What are these fancy words called emunctories? So maybe we start there and then we'll go into the treatment. How's that sound?
Sounds great. Yeah, I mean, I love that quote that says, we can't out-supplement a bad diet, right? Just like we can't out-supplement no exercise, things like that. It's like, yeah, you can take pills until the day is gone, but, unless you're doing these other things, you might not see the needle move the way you want it to. So, yeah, okay. I think the first thing you wanted to talk about was emunctories. Is that what you said?
Yeah, let's talk about, we hear these these like fancy, funky words like emunctories. I remember even when we were in school and our mentor was talking about them, we're like, what the heck is that? So what is this word emunctories? What does it mean? Open your detox pathways. You see this all over Instagram, like who's opening what, where do things go? You know what I mean? Like these things that if you're not a naturopath, you're probably like, what the hell does that mean?
Yeah. And we take for granted that we have the education to understand what all these people are saying. And then if you look at it from someone who doesn't, it's like, yeah, what the heck is that? So emunctory is kind of like an old-fashioned word for organs of elimination. And, I guess it's just a quicker way to say it. But you know, our five primary organs of elimination being the liver with the colon, or, you know, so the GI system, kidneys, lungs, skin. And when we talk about skin as a primary, we're talking about sweat and oil. And then the emotional state. And I'll tell you, when I tell patients this, they all go, huh? What? The emotional state? It's like, yeah, that actually has something to do with the way you're releasing things in your body. And there's like new evidence coming out about our fascia and how stored emotions can cause these restrictions in fascia. It's like, hello. And then when the fascia is restricted, can you eliminate, get things through there, through the lymph, get it out through the liver and kidneys? Probably not. So very interesting stuff. And then detox. Yes, we use the word detox the way people on Instagram use it, meaning like elimination, you know, interchangeably. Truly, if you're a medical person or a scientist and you're watching our podcast, we both know that the only thing that detoxes anything in the body is the liver. We know this, but we use the vernacular that everybody else uses because that's the way it is. So there are two phases in the liver. The first is phase 1 is this thing called the cytochrome P450 system, and it makes things kind of less toxic with oxidation and different things like that. And then it goes into a second phase, which is glucuronidation, all these big words, and makes it more water soluble, basically. And then it can go to the kidneys, or it can go out the bile through the bowel movement. So basically the liver is kind of like this amazing organ, which I don't know if you remember this, but one of my favorite things we learned in school was if you take a piece of liver out of someone, they'll regrow the liver.
Yeah, I remember hearing. I know.
You know, no
was,
other part of us
yeah,
does that, you know, like, well, I mean, like your nails and your hair, but no other
yeah,
organs, you know? So I thought
that
that was pretty crazy.
so cool.
It shows you how much we need it, right? And then kind of how we abuse it. And so, you know, I think it is important for us to use things that support, you know, liver detox. And then what else? I think you had
Absolutely.
another question for me.
Yeah, no, so I wanted to just comment on the fascia part that you said. So I didn't share this, and I thought this is really interesting. So I found this fascia lady here in California. I literally drive an hour and a half to her. I don't think I told you this. And she is a physical therapist who doesn't really do physical therapy anymore, and learned this really like a specialty thing called fascial counterstrain. And the first day I met her, she put her hands on me. I was like bawling because of what you just said. You know, as soon as you release the fascial restrictions, all that emotional stored crap, you know, comes pouring out. I cried the entire way home, that hour and a half. You know, like, with like the booger type, like crying
Yeah.
where everything's just reading. And I remember the next time I came into her, she was like, I actually just got this extra training. And I said, yeah, on what? She's like, on trauma. And I said, she's like, obviously the stuff we does already helps, but it's just like an extra training. And I said, oh, I would love to have you do it on me. And so interesting. She did this. It was the best way I can explain it, because you've had EMDR. For anyone who's had EMDR, is she puts her hand on your brain, and she's trained to feel where things kind of like light up or activate. And then she shuts it down, like she like regulates it, not like shuts it down in a bad way, but she asks you to start thinking of your memories, of like anything that has been on your mind or past memories. And she just, with a very light touch, the best we can describe it, it was like a fascial EMDR. It was so fascinating. And I had to say this because when you said the fascia thing, I had to share this story because it's so cool. So now, instead of going back to years of EMDR, you know, when you just feel like your body needs to release it, it's like, I'm not saying EMDR can't get your body to release it, but you know, when you just need that somatic, like you just need someone to put their hands on you kind of thing and facilitate something.
I think it's two roads to the same destination, right? And different roads work better for different people. It's how I feel about chiropractic versus massage. You know what I mean? Like, you know, one's working on the bones to help the muscles and the nerves, and the other one's working on the muscles and the blood to help the bones and the nerve. You know what I mean? So it's like, it's all something. It's all good. I did a myofascial massage, or I guess you could call it massage, but myofascial restriction kind of session with a massage teacher I had back in LA. And in that session, I was angry and swearing. I was crying hysterically, and then I was laughing hysterically all in one session. I was like, wow, this is powerful stuff, And for people, I was gonna say, for people who are in their minds and like have the rumination and like, when you're kind of dealing with trauma and you're like, well, then it could have been that I was like feeling this way because of this and da. Like maybe those people should do the body work instead of doing the EMDR.
Absolutely. And I love that you said that. It depends on kind of where you are in the journey, what your body needs at the time. And it's like when you said that crying laughing thing, if you're into homeopathy and there's like this remedy, Ignatia, where you're like literally like manic, where you're like you're crying in a bowl and then laughing hysterically, where it's like this like hysteria mania. So by the way, if you ever get to the point where you're laughing hysterically and then you're crying in a ball, try Ignatia, the homeopathic remedy.
It's great.
But I
think it's mine.
so good, right? I just
Yeah.
wanted to talk about that a bit more because people don't realize that they can detox through having this like emotional body detox. And it's like, yeah, we can sit here and talk about the liver, and of course that's important. But especially for you, as a Chinese medicine expert, even think of the organ systems, right, that you treat for just emotions, right? Like if someone's depressed, what you like heart, right? In Chinese medicine, right? Like Shen or anger is liver, kidneys, fear, right? Those emotions that could store, right? From a Chinese
so like
medicine.
the spleen, which is digestion, is a little bit more worry, whereas heart would be a little bit more anxiety. Liver, when it's really tight, would be anger and irritability. When it's medium tight, I would say is more like depression, PMS. Kidneys, fear. Lungs, grief. So, and it's amazing to see our patients and what they present with and how it is interrelated. I was just talking to one yesterday about another patient's success and how she was dealing with an autoimmune disease, and we did gut work and all the foundational stuff, and for almost a year. And finally I was like, okay, it's time to address this, the elephant in the room that you don't want to address. And she did the work in remission. You know what I mean?
Oh
But she had to do all of the things, not just the body stuff.
Exactly. And you'll know if you need to do the emotional stuff when you're resisting it the most. Those people who are just, you ask them, I think I've asked certain patients about this like 14 times. And then eventually they're like, oh, I think we got to address this, right? Because they just don't want to hear it. Because everyone just wants a supplement and want to feel better. I mean, it's easier that way. But that's why I wanted to talk more about this emotional part of the detox, because this is so important. You can't just focus on your liver and kidney detox and not focus on this, because even just that nervous system component of how we can just heal being in parasympathetic when we're not holding on to all of that crap, right?
Yeah, and to also give yourself grace and space when you're going through a detox, like a liver detox, and anger and irritability come up, or something comes up or comes out. Like, just give yourself that grace and space to have it, feel it, let it go, feel to heal.
Absolutely. Yeah, that's really important. Feel to heal, because a lot of us, we just suppress everything. And then again, that's just, even Dr. Tom, our mentor, used to talk about these miasms, another fancy word, just basically, and tell me if I don't know if I say it as eloquently as you, but almost like how you, almost like your immune system, or how you kind of react with the world or the environment around you is, would you say you're a miasm, or how would you say it a little more eloquently?
So I actually, because the words confuse people, the miasms themselves, I say that a miasm is a type of eliminator. So like a
Okay.
psoric would be efficient eliminator. Psychotic would be an inefficient eliminator, that kind of thing. So
Okay.
I call them
Potentially
like
a better
type
Yeah.
1, 2, 3, and 4, because otherwise they're like, well, I'm not psychotic. It's like, that's not what I mean. I don't.
Yeah, exactly. Because in there's there's this, so in my eyes, there's certain people who hold on based on how well they eliminate. They can hold on to physical and emotional toxins, and one happens to be, and I just wish they didn't call it this, because then it's like hard to explain to people without thinking you're calling them psychotic. But it's SYCO, right? It's psychotic. And that's the miasm where you hold on just to physical and emotional toxins, and then you're just not releasing. So, Dr. Sparks actually did training just recently to learn how to kind of focus more, because we learned about it, but not to the extent that you did, which, by the way, she's been doing work with some of my patients for some complex cases where what we would normally do is not kind of moving the needle. And this has helped so significantly. So it's just one other thing to help you. Like, if you are someone who's not eliminating properly, right, and those amuncularies are not open, maybe you need a very specific homeopathic drainage plan. So do you want to share anything about that and how that can also help? Because I know we talked about liver and, how that can help these organs of elimination.
Yeah, so there's also a thing in that schooling. It comes from France, I believe, Dr. Yinyo. So there's kind of a lineage there. And then we learn from Dr. Tom, and Dr. Abel is the person I just finished those 2 sessions with. The there's the miasm, which is the way you eliminate, but then there's also the thing that we call the temperament, which is what you were saying before, how you interact with the world. And when you're out of balance in any one of those things, it's not great. And so what we're doing is kind of trying to bring both of those aspects of your life a little bit more into balance, so then you are able to drain and eliminate better. For example, if someone is, let's say that they're the type 2 inefficient eliminator, and then their temperament is out of balance, and they're just kind of eating a whole bunch of stuff, like, and to kind of create more adipose or fat tissue to hold some fat soluble toxins, maybe mold. Mold loves for you to sit on your couch and eat chocolate so that it can just eat you, right? Like, that's what it wants. It doesn't want you to go away,
I
So
think it's like mold right for you, like
I know
coming
I
for
had a
you.
patient say, like, does the mold really think that? I was like, I'm anthropomorphizing the mold here, but yes, it wants you to stay and eat. It
Does
doesn't
the
want you to
mold
fix
really
it.
think that?
So I thought that was so cute. But yeah, so then if we balance your temperament, then you won't want to eat all of that. Like, you'll be craving the things that help kill mold or detox mold, and then the body will start to go, oh, now I'm safe to eliminate. And now an inefficient eliminator feels more safe to eliminate, and it's going to go. I'll tell you, it takes a long time with the inefficient type 2s to kind of get that needle to move. And with the type 3s, they're a different kind of inefficient. They also get kind of like really tired after they eliminate. So then you get these people who are like doing a detox and like, oh, Dr. Suppose I feel horrible. Like, okay, you have to back off. We can't go as fast with you. Right. So that's the other thing, so it's really interesting learning the 4 types, because you kind of go, okay, now we know how to treat here, and now,
Yeah.
as you explained, it's important that we have, like, you see a practitioner who understands those things and can help you through, because your patient who just did the cell core thing and was like, like, they're probably a type 2.
Yeah, she felt horrible because
Yeah.
people think more is better, and so I think I would say, and the most important thing we're gonna say today is more is not better, and you can still move the needle. I mean, I probably am the most slowest, and I probably, I don't know if it's like I'm a fast detox or a slow, but the point is I'm the most sensitive patient, so that's why I get sensitive patients. And I might have to put literally 1 drop of cranberry juice in a cup, and that can detox me, or in a glass of water, like a natural cranberry, no sugar, that might detox my kidneys and be exactly enough for me, where someone else may need 3 to 6 caps of a concentrated cranberry. So I wanted to bring that point up, so to know that you don't always have to go fast, and fast can actually be dangerous. If you're pushing yourself beyond the bounds of your physiological means to get things out, then you're creating all sorts of problems, right? Because think about all those patients. I know you just said this recently about a patient we share. Even if someone's kidneys are not functioning properly, or let's just say their GFR is not the best that it could be, and then they want to take more supplements or they want to do more things to detox. Like that do you want to talk more to how detoxing too much or too fast can actually be dangerous for the patient, and they have to start slow, and even if it may take a little longer, at least you're not putting your body into some crisis that's going to take so long to come out of.
Yeah, I mean, Dr. Tom used to talk about the difference between like chelation and drainage, where chelation, you're going past physiological limits, whereas drainage, you're staying within physiological limits because you're using remedies, right? So their remedies are energetic and they're telling the body, please do this. And then the body's like, okay, well, like, we'll see what we can do here, you know? Whereas chelation is like, we're doing this, good luck. You know what I mean? So
Exactly. Have you ever had a patient of ours that you feel would be ready for chelation? I don't think people ask me all the time, "What do you think of chelation?" I'm like, "Not my practice." I know maybe people who don't live in New York, maybe people who live like in a very like quaint area in the middle of America that's like very suburban and they have like a farm, maybe that they're not stressed. But my New Yorkers, if you gave them chelation, we, we would, I don't know what would happen.
yeah,
I
yeah, yeah.
actually am.
Well, and do you remember in our environmental medicine class with Dr. Cranian, he was like one of the foremost doctors in environmental medicine. He was talking about that one patient that was a guy who worked in a garage, remember, doing his
Yes.
restoration, his hobby was restoring cars, and he was so toxic, and then he chelated him, and then for the first time in like years the guy could like live again and walk again and do all the stuff he wanted to do again, but then he died, shortly after that
Oh,
because his kid went into kidney failure.
oh
Do you
my
remember
god, I
that?
remember that story. I didn't remember that until just now.
Yeah,
Yes, so you're like, "Oh, doing well," but now your body couldn't take it. And now look at the dire consequences of that.
yeah.
So the most important thing is do not feel that you have to push the body. I mean, even starting and when we talk about detox, we're talking now so far toxins like mold toxins to detox. We're talking about emotional toxins to detox. We're talking about heavy metals that are coming out, right? What
Glyphosate.
glyphosate. Oh yeah.
And then all
Glyphosate.
of the phthalates and sulfates and all the other things they add to our food and body products and cleaning products, things in our water.
Yep. Pharmaceuticals. I mean, there's laundry list. So these are all the things that are trying to come out. So think about kind of opening the floodgates too early. So if you are going to do I would say to anyone who's listening to this who doesn't have a naturopath to guide them, I wouldn't start doing these like heavy duty, detoxing items first. You could even just start with your diet. I mean, just eating a clean diet, our body is naturally supposed to detox, right? So even just focusing on good vegetables and lean proteins and fruits and nuts and seeds and this Mediterranean type anti-inflammatory diet can start helping you detox. And isn't that our foundations anyway? We personally do not detox. I'll never forget this story. This woman told me, she's like, you have to detox me. I just got out of school. And I was like, no, but she was stressed and she was not eating the best. And I was like, no, I don't do that. And she's like, no, but you're going to do that for me. Like a very bossy, New Yorker who's like, no, you're going to do what I tell you to do. Well, this is the biggest lesson. I gave her Undid 120 and 243. Those are liver drainers from the biotherapeutic drainage world. She told me that she was going to divorce her husband, give away her kids, quit her job, and run away because her, just everything came out. She
Oh
was
my God.
absolutely out of control after those Oonda numbers. And I've never done that before. I wouldn't do that to anybody. And so that's the point. You can start pushing everything out at once and feel like you're going to have a nervous breakdown and crack.
I had a similar situation. I had been doing undas for years with Dr. Tom. Then he put me on a protocol. And 2 weeks in, I emailed him because for a week my brain was telling me like, you probably have cancer, you're going to die. You probably have a brain tumor, you're going to die. Like it just wouldn't stop. Like everything was like, you're dying. And I emailed him like, I'm a little nervous. You know what I mean? And I said, this is getting dark, you know? And he says, stop him. I'm like, yeah, duh. And I stopped him. And then when I went in to talk to him later, he was talking about how those specific numbers were to help kind of like pull down the energy from ego. And it was the
Wow.
ego that was like afraid to die, it was an entire emotional protocol. And I was thinking like, I'm going to die. But it was really that part of me that needed to be perfect that was dying.
Oh my God, like an ego death remedy series. Wow. See, this is why I love these homeopathic drainers. We're going to do a podcast on just those.
Yeah.
Of this, like, drainers. I think that would be so interesting to people. But it's so funny where you're like, you convince yourself you're literally going to die. Like, it's not, and we're practitioners and we do this. How many times do I text you and I say something, it's almost embarrassing, the type of stuff that we'll ask each other. I'm like, did I go to medical school? Because you like lose all sense of logic. Like,
yeah.
hell?
Well, I mean, it's hard, like you said before, it's hard when it's yourself, you know? Like when I got stung by a scorpion in the neck and I just was freaking out. And then I texted y'all like, what do I do? And then you guys were like, well, what about this? What about, oh yeah, that's a good idea, you know?
Yeah, exactly. So. Thank God we have a group of other doctors when we're panicking that actually like, can answer us.
Yeah.
Answer us fast. Oh my God. Oh, this is such good information. One other thing I wanted to add about,
I was going to say the other thing that you were saying about, you know, you were talking about the Mediterranean diet, which I agree with you. I think a balanced Mediterranean type diet is the best diet for the majority of people. But then also sleep and drink enough water. Like, I mean, really, you know, like if you have, imagine you take a nice sheet of cheesecloth. Imagine that's fascia. And you put it in a thing of water. You can wring that out, right? But what if you go and you put that in that stuff that you make like paper mache with, the gluey toxin stuff, right? You can't get that out of it. It's in it forever. It's gluey. Could you get anything through that? No. Imagine your fascia, gluey toxinville. Like, it's not going to let anything go.
Such a good analogy.
You have to be hydrated, you know?
You have to, but I don't know what it is. And I don't know from a Chinese medicine perspective. I have to fight. I feel like all I do is talk about water the whole week. I feel like water, but no one's drinking. They're just not drinking water. They're just like, but I'm not thirsty.
It doesn't matter. Like this, like I have to have something that has a straw because I like to drink from a straw. That's the thing I tell people too, is find the way you like to drink. Some people like a cup, some people like a bottle, some people like a straw, right? I like a straw, so I always have to have that, you know? And then every once in a while, I'll just tell myself, take a sip. You know, I don't have to be thirsty.
Yeah, exactly. And you keep it on your desk. And now they have like fancy, my patient had to do it the other day, fancy water apps that literally will tell them when to drink because she just doesn't, like, she just will not drink. Like, she just doesn't get the cue to drink and she doesn't like want to drink. So I just like, well, you have to then put a Post-it or there's apps, but you're 100% right. I'm so happy you just mentioned that. The detox that happens during our sleep. And then as well, of course, making sure you're hydrated. So speak to the whole maybe kidney bladder, since we talked about the liver a little bit. Actually, speaking of the liver.
If you're working on detoxing from mold, supporting your liver is non-negotiable. That's why at Naturally Sue Wellness, we love Myco Detox Liver Support. It's a powerhouse blend designed to optimize phase 1 and phase 2 liver detox pathways with key ingredients like milk thistle, turmeric, artichoke, and dandelion root. It helps your liver process and eliminate toxins efficiently. Patients love it because it's well tolerated, effective, and a game changer for foundational mold recovery. Make Myco Detox Liver Support a part of your health journey today.
So this product has a really great combination of those herbs. And so with everything we said earlier, please do not take a ton of them. You can just take, there says 3 capsules. So for any person who's not being, supervised by a naturopath, even if they are, even one, right? Starting with 1, see how your body tolerates it, drink water, sleep, eat healthy. And then if you can get up to 2, and then if you can get up to 3, right? So just slow and steady will get you results. Doesn't always, like we said, have to be fast.
Yeah, and a key that I tell patients is when you're looking at supplementation like this, most professional grade supplements, herbal supplements, are based on a 150-pound person. So if you're a 100-pound person, then you would probably never take the 3, right? You would take just the 2. If you're a 200-pound person, you might end up taking the 4, So
that's a great tip because people don't even think of that. And think of if you're really like on the lower end of your weight range and you're 100 pounds and now you're taking 3. That's just
Yeah.
way too many.
And then another
Absolutely.
few keys that I give people that are doing things at home by themselves is, when you're taking what we call a supplement, a vitamin supplement to supplement your diet, you want to take that with food because it's supplementing your diet, right? So that would be like magnesium, calcium, the B vitamins, vitamin C. You want to take those with food. Now with herbs, this has more herbs in it than it does supplements. There's only, I think, 2 supplements in here. Inositol and choline, and L-methionine. So then there's more herbs, right? We have dandelion root, milk thistle, artichoke leaf, garlic, and turmeric. With herbs, I tend to tell people to, if you can, take them away from food because they're gonna then be in the intestines by themselves, so have a more powerful impact. Unless you're somebody who can't. So if you're somebody who can't, then take them with food. But it's optimal with herbs to take them away from food.
Yeah, that's a good point. And some patients can't tolerate it, and some patients tolerate fine.
Yeah,
So you just have
yeah.
to see. If you're
See
a
what's right
sensitive
for you.
person, not the best starting with on an empty stomach, but maybe you can get up to that. Maybe you can start tapering, start titrating up, and you're like, oh look, I can take it without food because I went slow and I gave my body some time.
Yeah.
So okay, so that's important too. And then also, I know we talked about for the kidney and bladder, of course, to drink a lot of water. But is there anything else detox that you feel is important to add about kidney and mycotoxins specifically?
Well, I would say that you would drink a lot of water so long as you don't have kidney disease. If your
Right.
GFR is under 60, you do need to talk to your urologist about how much you can take or your PCP or whoever. So that's important. The other thing we talked about before in the podcast previously was that mycotoxins are filtered out through the kidneys, as well as the bile, and it's important to know that some mycotoxins are bound to a protein called albumin, and so then it turns this tiny little mycotoxin into something big. And now protein is not normally something that comes out of our kidneys. Like it only usually comes out when the kidneys are damaged because it's a big molecule, right? So you have very, very fine filters in the kidneys. And so if this toxin, ochratoxin, we call it the persister. If it's bound to that albumin, it can't get out. So you might even, like I was saying before, if you have ochratoxin come up like medium on your panel, you might have a lot more in there because it's not coming out. So one of the things that we recommend are red and orange and yellow bioflavonoids. So peppers and squashes and things like that. So tomatoes
Oh,
to
that's
help break that
awesome.
bind.
Oh, so basically those bioflavonoid foods, using food as medicine can break that up so that it can actually eliminate.
Yeah.
Oh, that's so interesting. So that's
We're
why
thinking about.
if someone has toxin, you might know then this is why getting and we talked about this in our last podcast, that's why getting mold tests may be indicated for you to know, look, okay, now I need to focus more on this or kidney versus I'm going to focus more on this if another
Yeah.
species came up.
Yeah. I mean, there's also is it gliotoxin? One of them has an issue with sulfur, right? So you know how we tell people a lot of times glutathione, NAC, potent antioxidants in the body and help with glucuronidation, you know what I mean? Get the stuff out of the liver into the kidneys, blah, blah, blah. Well, with some, I think it's gliotoxin, it makes it worse. And so I believe that I had a gliotoxin issue when I was living in North Carolina because I couldn't eat garlic, onion, anything with sulfur in it.
Oh,
Yeah. So, I mean,
wow.
I
So
didn't do a
that's
test, but that's what I think I had.
so when you give people NAC and they literally feel like they're going to die, that could be
It might
maybe
be
another.
gliotoxin. Yeah.
That's so interesting. So this is why, again, and I'm so happy we're talking about this because when I was just learning about mold years ago, some of the doctors at some of the, like one of the mold companies was like, oh, well, if the person couldn't afford the test, you would kind of do the same things anyway, like the same type of treatment, which, yeah, that's true, but not true because the way you just said, if they had this, I wouldn't give this. If they had this, because how many people do you end up giving NAC or glutathione, which are sulfur rich, to people, and then they might have gliotox, just like you just said. So
Yeah.
that's why those people feel atrocious. And see, so that's really important. So that's why they have this at-home urine test that we use through Vibrant to be able to know. And then Dr. Sparks can actually go through and then give very specific suggestions. And what about skin? What about the emunctory of the
Oh,
skin and getting stuff out, like versus like exercising sweat versus sauna sweat?
yeah. It's funny because when we were talking about the emunctories previously, I was like, oh, I forgot to talk about the skin. So I'm glad you brought it up. So, we said that skin is a primary organ of elimination. And that's when you're, you know, exercising or doing a sauna or something, Epsom salt bath, and you're getting it out through the sweat or oil glands. But it's also a secondary organ of elimination. And they explain that to us as things like acne and psoriasis, eczema, any sort of atopic dermatitis, not a contact dermatitis, like not poison ivy, you know.
Right.
But whenever we're talking to people and we're talking about skin from the inside out, we're talking about kind of having this body burden. We talk about the body bucket, right? So you have the bucket with the organs of elimination. We're putting stuff in. Are we draining them out? Are we putting it in faster than we can drain it out? Or some of our drains clogged, and that's why the emotional body is important too, because it's one of the 5 major drains, right? So
Absolutely.
that's important. And there was something else and then there are other secondary organs of elimination like the uterus. So women actually having a menses monthly is a great way for them to get additional toxins out. And for the people that kind of get the shots so they don't have to have any more menses, you're missing a natural organ of elimination there.
1000%. Thank you for bringing that up, because people are like, oh, well, I don't want to get my period, so this is magic. But now a whole pathway of elimination is now closed.
Yeah, I remember Dr.
Yeah.
Tom talking about how, not people with, extreme menorrhagia, like really, really heavy periods, but, an average period when, as a naturopathic doctor, we can get people to have periods without pain, right? Oh, novel. Just because a lot of people have pain doesn't mean it's normal, Um, that kind of thing. He said that the studies showed that when women, went through menopause, that their risks for heart attacks and different cardio events started to match men, whereas before we were, less per capita than men. But when we go through menopause, we start to equal out. And so in his mind, obviously it has to do with the protection of estrogen and different hormones, but also the fact that we get to eliminate extra every month.
I love that. And also, right, don't they say that women, I think it's like women have a longer lifespan just because they get rid of that iron every month, right? That
Yeah,
could be
he
so
mentioned that.
oxidative.
Yeah.
Right? Think about men, they get rid of that iron and then they end up in pain and think about just like something that's like oxidizing over time. Think of that iron in the body that can then cause all these issues with the cells. So thank you for bringing that up as the uterus being like another emunctory, because even, I don't know if you've seen people, I've had people come to me with vaginal discharge that is extra, but there's no infection. And it's just that's their way of draining because the other maybe emunctories are not working.
Yeah.
So I'm really happy you brought that up. And are you a fan of saunas or not a fan of saunas for detoxing mold?
Yes and no. So with there at the Vital Gathering, like 2 years ago, oh my gosh, I forget the name of the doctor. He was talking about the 4th phase of water. And he was talking about how there's when you use infrared, it turns this water into what he calls EZ water, where it lines up in a certain way up against proteins, and then it leaves the space for like toxins to come out and push out of the cell. And it can be really detoxing for people. And so for those people that we were talking about that are the inefficient eliminators or the type 3s where they get like after an elimination, I would say that they should start with a wood sauna and less likely an infrared sauna, because they're getting more of a detox. So with a just traditional wood or steam, then you're just, you're just sweating, right? So you're getting the elimination out of the body. If you do infrared, you're detoxing cells at the cellular level as well as the sweat, but that might be too much for some people.
Okay, so the fancier one, there we go, may not always be better for you. So if
Right.
you're at a point where you feel great going to an IR sauna, then that's amazing. Then you
Do
know
it.
you can do that. That's a great, because sometimes patients will only have access to these IR saunas, and I'm like, oh, I'm getting nervous. I'm like, are they gonna be able to handle it? So I tell them, stay in there for like 5 to 10 minutes, right? Like, don't, people just are in there for like an hour, and then I get an email the next day that they feel like they're going to die. So, I would, if you're a sensitive patient, that's a great idea. Start with just like a traditional one at your gym, maybe that's not an IR. And then if
Yeah.
you can, so, some people have availability to get one near their house. I personally have the Therasage where it's like you stick your little head out of it. You
Oh
can
yeah.
go in it whenever. But again, I'm sensitive, so I start with just a few minutes, Um, it's like a little tent, and why I like that one is it's I don't think there had any EMF readings because you're plugging in a wall, then you're sitting in it, so you have to make sure that the ones you get on, like, Amazon that are, like, $50, you're, like, literally just in an EMF, tent, and now
Yeah.
you're just getting radiated, so we're kind of missing the point of this being a healthy thing to do. So the Therasage, I really like them. I'll put my link in the caption, but my discount code for them is dr.susanc. I really like them because they also have a red light panel in there, and then they have this nice grounding pad, Dr. Sparks. You can take it out. So when I don't feel like going to the sauna and I'm feeling a little cray cray, I need to like come down to earth. I pull the little grounding pad on and I just stand on it, and it's hot. And so you could just like pull it out of the sauna.
Oh, that's
So it's
perfect.
really nice, and then it also, you would love this, it has this little, rolly acupuncture thing for your feet while you're in the sauna. So it just, like, helps any type of, like, acupuncture points to kinda help, elimination. So you're sitting in there with the grounding pad, rolling your feet. It's
Self-care 101.
exactly, healthcare 101. We
Oh,
love it.
can I
So
mention one thing about the grounding?
yeah.
Years ago, when we first started school, do you remember Dr. Nick was talking about grounding? And I had plantar fasciitis for 3 years and had got a podiatrist, blah, blah, blah. Nothing worked. And then, so I bought a grounding sheet way back then. And within a week to 2 weeks, it went away completely. And then
For your
recently, and
plantar
then you couldn't find them.
fasciitis?
The what? Yeah. So,
Really?
so just so patients know, people listening to this know, itis, anything in doctor speak that ends in itis means inflammation. So it's inflammation of the plantar fascia is plantar fasciitis. So, and grounding is supposed to decrease inflammation, right? And then, so then for a while, when I was in acupuncture school, they didn't even have, you couldn't buy them anywhere. They kind of went out of stock. Now it's like a big thing on Amazon and Instagram, what have you. So I bought another one. And remember, we did some blood work last year and some of my inflammation markers were high. I got another grounding sheet from my bed. They're within range.
No.
Yeah.
Awesome. Like, I always write posts about how grounding decreases your inflammation, but I never actually had a direct
Like
thing to say,
linked.
"Hey,
Yeah.
like my plantar fasciitis went away and now my inflammation markers are down." Oh my god, I'm gonna get on it right after this.
Yeah.
Well, no, I have a patient, but after my patients, I'm gonna go stand. You just inspired me right now. That's so cool.
Yeah.
And what about these people who take, so I want to talk a little bit about binders before we
Mm,
then close with what
right.
things you could take as like basic things to help your health and just start moving toxins out. But what about all these people with obsessions about binders? So can you talk about what a binder is, and then how it can hurt people if they use it at the wrong time? And then
Yeah.
maybe we'll talk about kind of what are safer ways.
Yeah. So I think binders became the rage just because of Instagram, maybe. And everyone talking about it, and then everybody thinking they need these specific ones from different companies. There's one thing that you said is, what were you saying about the testing? To ask a company about their testing.
Oh, yeah, ask for a certificate of analysis of your binders, because some of these binders, because they're made of clay and all sorts of like different things that can come from the earth, they can have high heavy metals. And yes, certain like lead is a mineral too, right? Like there's can be even lead naturally occurring in the soil, but we don't want these things in high amounts. That's dangerous. So always ask your company for the certificate of analysis to know that these binders are not high in metals, because people are thinking they're binding their mold and now they're coming up with tons of, you know, issues with metals now. And now that's causing even more chaos.
Yeah. So that's just something that's important. Another thing is things like activated charcoal, different types of clays. Those are what we call like really intense binders. So you and I would use those when we're actively trying to detox or kill something, right? Like, oh, let's kill some Lyme. Let's give you a binder because there's going to be a war here and you're going to have like all the stuff that's coming from the dead Lyme, all the stuff that's coming from like dead immune cells. It's going to be a battleground. You know, like think of
Exactly.
Braveheart after a battle. That's what it's going to look like in your intestines, right? So, you know, and that's not going to feel so great. So then we want to bind that up to get it out the bowel movement. And those are really intense. They're like, imagine just people going through with like wheelbarrows, just cleaning up all that mess. Ah, you know, but they're not discerning. They're kind of like, you know, the people in Braveheart that maybe aren't the smartest people in the world. And they're also taking calcium and maybe some magnesium and iron and all the other things that you're eating and binding them and putting them out the bowel movement. So you can't take them near food, near definitely not medications. Like if you're taking a heart medication or a thyroid, like not near medications. I have people do binders before they go to bed because they're not going to eat anymore
Hmm.
and they're not going to, you know, take anything. But I think that's all you asked me about that. But then also there are more safe binders that you can kind of do every day that we're not as worried about. Oh, and we also just don't do those really harsh clay or activated charcoal binders in children. Nobody under the age of 15 should be taking those.
That
'Cause
makes
those,
sense,
you
especially if
know,
they're going to thrive. Now you're not going to take away potential nutrients from them.
calcium, right? Like, are you kidding me? So,
And then there are a lot of I think kids that are constipated too. And that and then also mentioning like how many people I just had someone the other day, she just decided to take a binder because she was constipated. And I was like, no, but I think or she was not she was like, I think I'm backed up. So I'm gonna take this GI detox binder because it's called GI detox. So she thought it was a detox. So she decided to take it and now she's 10 times more constipated. So that's why we never also do it in the beginning unless I have to say, this is just me. I have never needed binders more than maybe like 10 times in 10 years. I don't think I need it because I use drainers. I
right.
don't know, for some reason, and maybe, I don't know, maybe this is not what everyone's perspective is. You might have a complete different perspective, but I've always used drainers and I've never needed a binder. Only like once in a while I've used them. Now I'm starting to use like what is it, the Pectisol, which that's too like,
Ooh,
or things citrus pectin a little bit more recently because I just started learning about that. But
yeah.
do you even feel like it's like uh, do you feel like some people can really benefit from it and then some people may not benefit the most from it, just depending on the patient?
Yeah. I would say, you know, the people who are actively detoxing or killing bugs that are really sensitive to the metabolites, yeah, for that month, let's do it. But I've had people come to us that say, you know, I saw this other practitioner and they just put me on, you know, this lime herb and a binder. And I was like, eh. I'm like, what? You know, no
I
foundations,
know.
no anything. The other thing is, we're talking about foundations. Well, what's one of the best binders that you can eat 10 times a day is fiber. So if you're having somebody with a foundation eating a good diet and getting plenty of fiber, they don't need a binder, you know?
Absolutely. So it could be so helpful for people. So I want to make sure I'm very clear on this. Just because I haven't needed to use it with some of my patients doesn't mean that there's not a place like Sparks might have had to use it a ton of times more because we might see different type of patients. So I happen to get tons of constipated patients. So that's just not the right time for them. But if a patient is in an active, they've done their foundations, they're now in an active killing phase, and we want to help them from feeling like crap, we would absolutely consider binding. And one of the microbalance products that they actually have is the bioactive binder. So I actually asked the women at the company regarding the purity because I'm very concerned about the heavy metals, as I said. And I'm just going to read a little bit about their statement. She said, "We only use pure zeolite and Prima V shilajit and coconut charcoal, all purified and tested prior to formulation, and then the product is tested again and cleared before distribution and release. The trademarked ingredients ensure standardization and purity in a manner that raw materials don't always have." See, so you always ask. So I would ask that before we would ever give, I love this company, but of course I'm going to still ask. I can never just trust someone enough to to just assume that maybe their product doesn't have metals. So this product, their bioactive binder, they have it says zeolite clay, iron with a very, very small amount, 2 milligrams of iron, zeolite clay, activated charcoal, shilajit, and fulvic acid. So they say here are 2 capsules between meals, but Dr. Sparks, same as myself, will have people do a binder right before bed because it's easy. Just have them keep it on their nightstand, and they're not really having food unless they just binged on popcorn. But usually people shouldn't be eating right before.
Well, and
before bed.
how much calcium's in your popcorn?
Right.
And then
Yeah.
also like, we always talk about, gut health and how important it is to be in rest and digest when you're trying to eat some food so that your intestines do the peristalsis, which is probably a huge problem for most of our constipated people. So when you are sleeping, you are automatically in rest and digest, right? So,
Yes.
you know,
Yeah. I love
um,
that. And so the other thing I wanted you were telling me there are some food binders that were
yeah.
always appropriate.
Yeah. So, Dr. Krista talked about how I think a cup of steamed kale was about 1/4 as potent as a pharmaceutical binder. Just a cup
No
of steamed kale.
way.
Yes. I can't remember the name of the binder that she was talking about. Maybe it was cholestyramine. I don't know. So
Oh,
that was
yeah.
kind of cool. And then she was talking about other food binders that we use. You know, we could use flax, chia, those types of things that are, you grind them in your smoothie, or if you're not going to do some sort of smoothie, always get them whole and then grind them yourself because we don't want them to get rancid, be exposed to too much oxygen. We keep them in the fridge. Seeds and nuts always kept in the fridge. And then you get your own coffee grinder just for your seeds. And you really need to grind them up like that because otherwise it's like your teeth are not doing the job. We all know that people like chew one, swallow, you know. So you really need to grind them up. And then those aren't great though for people who have SIBO. So some seeds that you could use that are SIBO okay or FODMAP okay would be pumpkin seeds, sunflower seeds, or sesame seeds. So you can
Oh,
grind
that's
those
good
up.
to know. The placebo patient as much you're saying. Oh, that's good
Yeah,
to
and
know.
then a few other things. You've heard of Saccharomyces. Some people will use that as a binder, but you can't use that if you have the mycotoxin I can never say these, zearalenone.
I know. I
They're
don't know.
so hard to say, because it actually will keep it in its reduced state, keeping it around longer. So she doesn't use
Whoa.
Saccharomyces with everybody. And then spore biotics, they actually bind everything, but there's one that it doesn't bind. I can't remember the name of it. So spore biotics actually bind every mycotoxin that we have on the test except for one. I can't remember which one it is. So that's a great thing to do.
Wow.
Like, if you're going to take a spore biotic, it's also going to work as a binder.
Yeah, that's so good to know. So you people are not thinking of probiotics being binders. So let's just say you're starting slow, you're constipated, and maybe you're going to start there. And then now you're in the active killing phase of mold or getting stuff out. And now that's the appropriate time for the binder.
Yeah. Yeah.
Okay. I
Well,
love that information about the seeds though, because I didn't realize that those other seeds can exacerbate a SIBO patient.
yeah. Yeah.
So
They're
good to know.
on the FODMAP. Oh, psyllium husk is also, and bran can also exacerbate a SIBO patient, but are good in non-SIBO patients. And I remember
Okay.
it's macrolytic trichothizines are the ones that don't do well with spore biotics. Everyone else does. So like verrucarin.
Okay. And we would know that by doing a urine mycotoxin test, exactly the one that you have. And then one other thing, technically, it's not a mold binder, but immunoglobulins. So immunoglobulins, they will act as an intestinal binder. So for example, if you have other infections, most of our mold patients always have these other things too, whether it's they might have H. pylori, they have SIBO, they have Lyme. So as you're killing off all of those, it's good during that killing protocol to also consider immunoglobulins. So Microbalance has an IgG gut protect, which is a serum derived bovine immunoglobulin, which I like because the ones that are made from dairy, we have a lot of patients sensitive to dairy, but the immunoglobulins from bovine are usually well tolerated. I personally have been taking immunoglobulins. I take just probably a fourth of what the normal dose is, but for I would say a couple years already, and for the first time, my secretory IgA in IgA map is normal. And it's really important too because these immunoglobulins can support your immune system in your gut. And basically, like your soldiers saying, hey, virus, parasite, bacteria, you need to get the hell out of here. Because a lot of our mold patients that I've been seeing in Lyme patients, they're all low in secretory IgA. And then this is, even though it's called IgG Gut Protect, it's basically a combination immunoglobulin complex that has these immunoglobulins in it. So just something also to know this can protect and help your gut as you're on one of these protocols as an intestinal binder.
Well,
And is there
I
anything
think
else about binder? Yeah.
I was going to say that harkens back to our previous podcast about colonization, right? And then if you have kind of mycotoxins suppressing immune system in the gut, then that's very helpful.
Absolutely. Absolutely. So definitely listen to the other two because this all kind of builds on each other. You're going to get tidbits from everyone, even if you listened out of order, but it's kind of a nice sequence to make sense because a lot of information here and we can look, we're almost at the hour and there's like so much to
Oh my
talk
gosh.
about always. Why this is just mold. So Dr. Sparks also, so she does have a mold VIP program where she does walk people through a 6-month program. We talked about this last time. You can also book a free consult with her to see if she's right for you. But also, we wanted to be able to support people who, let's just say they wanted to try some things on their own. And also just for this podcast too, if you want to come away with some things that you could start taking that are not super, super harsh or detoxing. She actually created a curated full script protocol of just a few items that you can consider. You don't have to take all of them, but can you just share a little bit more about this mold? It's like a mold basic supplement starter kit type of thing and like what's in there and how do you feel like some of these products can help and maybe where would you start if people were just kind of DIY?
Yeah, so as you remember with Dr. Sensitive and Dr. Tong, they always talk about like what's the least common denominator, right? Like what are you going to get the most bang for your buck, right? So there's one in there that's vitamin C with quercetin. So vitamin C isn't potent antioxidant, right? And immune support, but it also helps with adrenal function. And then quercetin can also help is a bioflavonoid, so it can help with that kidney detox that we were talking about, right? The mega spore biotic, put that in there because, like we said, spore biotics are great binders for almost every single type of mycotoxin. Plus, it also helps with just intestinal health. And whole body detox, that is a homeopathic detox, so we're not using like severe herbal detox kind of stuff. But still for the sensitive people, You might want to start with 1 drop, see how you do, right? And then slowly work your way up to the full dose on, if you can even get to the full dose on the bottle. But that works at a cellular level, right? So that's great. And I would have you start that as maybe the last thing in the package, right? Because you want to do the foundations and make sure you're drinking enough water and you're having a bowel movement every day before you start eliminating. The Pro Omega 2000, it's omega 3s, DHA and EPA, so anti-inflammatory, but also good for the brain. Like I said last time, the key to pollution is dilution, right? So we're diluting these fat-soluble toxins, so that's really good. And then liposomal glutathione, like we said, some people, it might, depending on their mycotoxins, it might not be great, but for the majority of people, it helps with elimination of mycotoxins, speeding up that process through the liver.
Thank you so much for that. Yeah, exactly, through the liver. And again, if it says 1 teaspoon, maybe you start with a 1/4 teaspoon, right? But again, I would never do any of the detoxing stuff. If you're not sleeping, not drinking water, your diet is inflammatory, you're eating out every day, just doing those things. And even just one thing just to close to mention too, just cleaning up your environment can just help your body, right? Not have as much of the toxic burden. So that's where the Microbalance company has like the laundry additive that you can add to your laundry just to help with those, right? To make sure you're addressing mold there. They have mold candles.
But I am someone who loves candles, so I'm like, why don't I do a 2-for-1 and like attract spores while I get to have my candle going? So it's one of
Yeah.
my things that I do.
You're saying that it's like, oh, you're saying it's like one for not just so therapeutic, it can also be for like maybe like just
No,
using a candle, like just like a
yeah, oh yeah, because I just use them therapeutically, but also just, because I like having candles
because it's
around. And I
yeah,
don't want to like
okay. I
carry
have to try.
my air filter to every room every time I'm going. So I have candles in every room.
So you keep your air filter on, clean up your environment. You put your mold candles, and there's no I put them. There's no scent, thank God, because I get migraines. I don't want scents coming out of my candles, so there's no scent. So don't worry if you're, because a lot of us have those multiple chemical fragrance sensitivities. Don't worry about that. And then I usually put in my dishwasher like once a week. I like wash with that mold spray just because like it gets like cruddy in there.
Yeah. Don't forget to take out your filters, clean those out as well. And then they said that you can
Oh
use either
yeah.
the laundry additive or their concentrate as like a tablespoon to do the clean in your dishwasher and or laundry machine.
Love that. And then, yeah, those are the main ones. And then they recently, I think over the last year, came out with those wipes that you could just like wipe down your whole house easily. So cleaning up your environment, another huge part of detox.
Oh, can I say one more
I
thing?
think,
Sorry.
yeah, of course.
You just said, clean up your house is important. And I was just listening to some inspectors, that I'd listen to them a lot so I can learn more about the house, because we know stuff about the body. We're not as, we don't know as much about the house.
Exactly.
But he said that once you remediate, you need to be thoroughly cleaning your house weekly for 6 months after remediation. So those
Wow.
wipes and their fogger, those kinds of things are going to be important for the 6 months after remediation.
Oh, I love that fogger. I
I
just
know
talked to a
you do.
patient yesterday. She was like, I didn't have any. She did the microbalance test plates, and she's like, look, there's nothing here. But then I tapped my carpet, and it was like she showed me on the video, and I was like, yikes. So she's like, I should probably dump it, right? And I'm like, yeah. And then she's like, well, what else can I do to clean the environment? And I said, well, first of all, wear a mask. Put that, when you're picking that thing up. And she has a lot of anxiety. So there we go again with the brain on fire. And then I was like, get that fire. She saw it. She was like, wow, because that thing looks so cool. I showed it on my, did you see my Instagram where I was fogging my Christmas tree?
I love it.
I love that thing. I couldn't stop fogging. So yeah, they have a fogger, which just lastly, and I think I might have shared this on one of the others, one of the women who works at the company, she shared that it's okay for me to share this, that she has an autoimmune condition. And when she feels like she's flaring, she does fogs once a month. And then all of a sudden her symptoms come down. Like, so she feels like it just kicks up mold, and then her autoimmunity just starts. As we know, one of the causes of autoimmunity is environmental toxins, right? And she says that's when she knows she needs to fog. How cool is that?
I love it. Oh my gosh, I love it.
I know, right? Oh my goodness. Thank you so much. This was so amazing. Is there anything else, lastly, that you thought was super important, or we think we got everything for now until our next one? Okay, perfect. Thank you so much for joining. This has been a pleasure as always. If you have any questions for us, you can DM us on Instagram. My Instagram, dr.susanc, and then, dr.susanc, and then Dr. Sparks, Dr. Sparks, Dr. Sparks ND. You can find us at naturallysue.com, and we'll also put some other resources for you in the caption. We have a discount link that you can get products for Microbalance, all of the products we talked about earlier. And for any Microbalance health products, please visit the Microbalance health products /modern-day-naturopath/ and use code MDN at checkout for 10% off of your order. Thank you again for joining. I'll see you soon.
Thank you.
Bye.
Bye.
Thanks so much for listening to Modern Day Naturopath Podcast with Dr. Sue.